talk about some things to consider when doing Pilates during your first trimester of pregnancy. Now, everything we're going to talk about totally applies to other types of workouts and movement as well, but I'm just going to give this a Pilates focus because those are the classes I will be sharing to YouTube throughout my pregnancy. I'm really going to focus in on prenatal Pilates. My hope is that when you're newly pregnant, this video can serve as a general guide, maybe answer some common questions that come up, and sort of give you a few things to focus on. And I'll make one for the second trimester and the third trimester as well when I get there. If you're new to my channel, welcome. My name is Nicole. I'm a STOTT trained Pilates instructor and a pregnancy and postpartum corrective exercise specialist. And maybe my most important label right now is that I am also a fellow pregnant lady. I am well out of my first trimester. At the time I'm filming this, I'm 21 weeks along, but I digress. Let's get into it. Change during pregnancy is inevitable and it's beautiful. Your body is going to change, period, end of story. You don't need me to tell you that. So our goal in staying active and working out and doing Pilates during pregnancy is not to prevent change, it's just to manage that change, to support that change, and in some instances, maybe to slow the rate of postural changes and compensations so that we can make postpartum recovery a little quicker, a little easier for ourselves. Now, in the first trimester, the baby isn't taking up a lot of space yet, so there may not be too many physical changes that you can see and need to modify around. That being said, there are still some things we want to start to consider and that we can start working on in the first trimester and continue to work on throughout pregnancy. So I'm going to start by kind of going over a couple big things I want you to focus on. First up is 360 breathing or diaphragmatic breathing. And if you've been taking non-prenatal Pilates classes with me prior to pregnancy, you already know all about this and you already have a lot of practice doing this. But essentially with a proper 360 or diaphragmatic breath, as you inhale, the rib cage expands three-dimensionally, so it doesn't just expand forward, it expands into our sides and into our back. And as the rib cage expands, the pelvic floor relaxes down. You don't bear down, it just relaxes down. On the exhale, the pelvic floor lifts, gentle brace of the abdominal wall, and the ribs move in and down. Now, proper 360 breathing is important because the diaphragm and the pelvic floor work together with our breath. And when everything is functioning properly, it helps us manage intra-abdominal pressure. Now, when we're unable to effectively manage the pressure inside our abdomen, that is when we can get issues like hernias, diastasis recti, prolapse, and lower back pain. Now, during pregnancy, our diaphragm gets pushed up to accommodate the baby. That's now taking up more space, and our ribs get pushed out. So increasingly, it becomes difficult to get a deep breath in or to exhale fully out. And as these changes are happening and our abdominals get stretched out, our back tightens up to accommodate the weight we're now carrying in our front. You won't experience these things in your first trimester, but eventually in pregnancy, every woman will somewhat lose the ability to take those deep breaths in and out. But if we work on this starting in the first trimester and all throughout pregnancy and are really consistent with it, then we will help regain the ability to get those deep breaths and move through our rib cage quicker postpartum. So we want to be mindful of staying as open as possible through the sides of our body and through our back. So you want to stay really mobile through the mid-spine. You want to try to stay open through the sides of your body. And on the inhale, we really want to focus on expanding into those areas. So rib cage expansion out to the side and into our back. Because if you can't expand the rib cage into your sides and in your back, where are you going to get that expansion when you inhale? It's all going to be expansion out the front, and that constant pressure out the front is going to set us up for a more severe diastasis recti or separation of the abs. So working on lots of side bending and mid-spine mobility and rib cage expansion throughout our Pilates classes in really every trimester, it can help us prevent severe diastasis and ab separation down the line. Now, it may not prevent those things completely. These things happen and that's fine, but it can help us manage those things. So 360 breathing, check. Start working on it now in your first trimester if it's not something you already work on. Second thing I want you to start focusing on is connecting to your pelvic floor. And that really goes hand in hand with breathing. We were just talking about how constant unmanaged pressure out front can lead to a more severe diastasis. Well, constant unmanaged pressure down on your pelvic floor can lead to prolapse. So we want to make sure that we can manage that load and we can lift things up, we can move throughout our day and through a workout without bearing down on the pelvic floor, because prolapse can occur during pregnancy. When most people think about working on the pelvic floor, sorry, my leg is falling asleep. When most people think about working on the pelvic floor, the first thing that comes to mind is Kegels. And when we do that gentle lift of the pelvic floor on our exhale, that is essentially a gentle Kegel. But for the pelvic floor to be its strongest and to function properly, it doesn't need to just be strong on the contraction, it also needs to be able to relax. So for some people, if they're having pelvic floor dysfunction, the first thing they think is, oh, I got to do a million Kegels, I got to strengthen my pelvic floor. When in reality, the issue might be pelvic floor tightness, and instead of doing a million contractions, they should focus on trying to get the pelvic floor to relax. So don't just focus on, am I able to lift or contract the pelvic floor when I'm doing a certain exercise or movement? Also notice, okay, am I also able to let it chill out and relax? And when I say relax, it's not a pushing down on the pelvic floor, it's just a relaxing. And it can be helpful to try Kegels in different positions, standing, seated, with your weight shifted on one hip, with your weight shifted on the other hip, with your pelvis in a posterior tilt, with your pelvis in an anterior tilt, because different positions will be beneficial for different people. And you may find that in certain positions, it's easier for you to get the pelvic floor to contract and relax, and in other positions, you have difficulty. And if you're someone who's dealing with pelvic floor dysfunction and you're not really sure where to start, or maybe there's no dysfunction, but you're just totally unacquainted with the pelvic floor and feeling a little overwhelmed, seeing a pelvic floor PT at some point in your first trimester could be extremely beneficial. You'll have to do some Googling if you're not in the Boston area, but if you are in Boston, I would recommend Foundations Pelvic Health. Even just a couple sessions could be very enlightening. In all of my prenatal Pilates classes, we'll address the pelvic floor. We'll talk about pelvic floor strengthening, engagement. We'll also talk about opening up through the pelvic floor, but it's in a more general sense. And having a one-on-one session where someone can pinpoint what is best for you individually could be game-changing. So a pelvic floor physical therapist might be something you want to look into in the first trimester just for some guidance. But speaking of my classes, we will show the hip joint and the surrounding area a lot of love in my prenatal Pilates classes, because the hips and the surrounding muscles they go hand in hand with pelvic floor function. Your pelvic floor sits in between your hips. So working on strong deep hip rotators, adductors, glutes, all of that kind of ties in with a strong and properly functioning pelvic floor. And just one final note about the pelvic floor and prolapse before we move on. So in the first trimester, constipation can be very common because of all the hormonal changes, and chronic constipation can be a cause of prolapse. So you want to make sure that you are not straining when you go to the bathroom. This is not my area of expertise, so look into it on your own if this is something you're experiencing, but I do know coconut water can be really good for constipation. But while we're speaking of going to the bathroom, just something else popped into my mind. Worth noting that working on your pelvic floor in early pregnancy will make you less likely to develop incontinence later in pregnancy. So just a little fun fact and further incentive to start working on this now. So diaphragmatic breathing and connecting to your pelvic floor. If those are two things you do not currently work on, I want you to start working on those now. Now let's shift the focus into modifications you should make when you exercise during your first trimester. And there really aren't too many of them, especially early in your first trimester. You don't have to make too many changes to your workout routine. The exception to that would be if you are someone who typically does really intense workouts all the time, you would probably want to dial down the volume on that a bit. Moderate exercise during pregnancy is awesome, and there are all these studies supporting the benefit of it. Moderate exercise is associated with increased fetal placental growth rate, which is a great thing. Moderate exercise during pregnancy is linked to a decreased chance of developing gestational diabetes. Another great thing. So exercising during pregnancy is great, but strenuous exercise, like where you're working out to the point of complete exhaustion, there are some negative potential effects to that. Strenuous exercise to the point of exhaustion can create an increased sympathetic response. Your sympathetic nervous system is basically your stress response. It's associated with fight or flight. Also, strenuous exercise is linked to decreased maternal placental blood flow and decreased fetal growth rate. So those are things we would want to avoid. And it doesn't mean you have to stop working out. Like if you are an athlete and you're used to intense workouts, you can still work out pretty hard. You would just want to dial down the volume of it. Now, all of that doesn't really apply to Pilates. You're typically not working out to the point of being breathless and absolutely exhausted during a Pilates class, but I thought it was information worth sharing. And it's worth saying, like, if you are someone who is used to pushing yourself really hard during workouts, mentally it can be a hard change to make. It can be hard to kind of dial it back a little bit. So just remind yourself that the less damage you do during pregnancy, the quicker and the easier your recovery postpartum is going to be. So the quicker and easier it is going to be for you to return to doing those things you love. So if something you're doing during pregnancy is causing pressure out and down, it's leading to a severe diastasis, it's leading to prolapse, then it's probably not worth doing. Now in Pilates specifically, the modifications we make are more so in relation to body position. So prone work, for example, work laying down on your stomach, that's going to get the axe in the second trimester, but it may be fine in the first trimester. Every pregnancy is different. I'll use myself as an example. This is my first pregnancy, so I didn't start showing until I was weeks into my second trimester. So during the first trimester, there really weren't any physical changes around here, so it was very comfortable for me to continue doing prone work, and I did continue to do prone work business as usual. You may find that you feel that way for your early first trimester, but then maybe in the second half of your first trimester, you decide to eliminate prone work if it's getting uncomfortable. But early on in your first trimester, prone work is fine. Similar thing goes with supine work laying on your back. As the uterus and the baby get heavier and heavier, that we would want to shorten the length of time we spend on our back, or maybe even eliminate it altogether. But we usually don't get to that point until the second trimester. So typically in the first trimester, it is fine to do exercises where you are laying on your back. The exception to that is going to be if you feel nauseous, dizzy, lightheaded when you're doing work laying on your back. That would be the sign that for you, we're going to eliminate that a little earlier, a little before the second trimester. And I will talk more about supine work in my second trimester video because there is some stuff I want to go over with that. But for the most part in your first trimester, it's fine. Now, what about intense core work? Teasers, leg scissors, hundreds, planks, all that good stuff. Now, in the first trimester, the baby and your bump, probably not big enough to logistically get in the way of doing those exercises, but those exercises do create a lot of intra-abdominal pressure, and you may find that it's getting harder and harder to control that pressure. If when you do those exercises, you are feeling pressure out on your midline, or you're seeing doming or coning on the midline, that is a sign you definitely want to eliminate those exercises or modify them. If you're someone who is advanced, you may find that you can do them through your first trimester, though it's really going to vary person to person, and it all comes down to pressure management. You're going to hear me talk about that all throughout. I wish it was easy as saying this exercise is okay until this point. This exercise is okay till this point, but it's going to vary person to person. It just depends on what you can control. For me personally, when it came to core work and Pilates, I would say around 10 weeks, I started shifting my focus more to just deep core work and stabilizing the spine in neutral versus a ton of flexion-based core work. It just felt more comfortable for me. Everyone is going to be slightly different, but up until that 10-week point, I pretty much just did Pilates as normal. That felt fine for me. So while you don't have to make, my leg's falling asleep again, while you don't have to make too many modifications from like a physical logistical standpoint, you may need to make modifications to your workout routine due to feeling like absolute crap. It is very common to feel exhausted in your first trimester because of all the hormonal changes. So you may miss a few days of working out to nap instead, and that is okay. Now, I know this requires a mindset shift for a lot of people, and it can be anxiety inducing if you're someone who takes comfort in a certain workout routine. But especially during the first trimester and really all throughout pregnancy, now is the time to let go of rigid workout plans. Some days it may not happen, or some days your workout may happen, but it looks a lot different than you intended it to because you're just not feeling that great. I know I definitely experienced this in the first trimester. I was tired, I was nauseous in the afternoons, and I also was experiencing really bad hormonal headaches. I'm talking these headaches would last like 6 days in a row. I'd get 1 day of relief and then I'd get another headache. So pre-pregnancy, I would work out 5-6 days a week without even thinking about it because, you know, a big factor in that is it's part of my job. But then once the first trimester hit, it was really humbling for me. And I was looking at more like 2-3 days a week working out if I was lucky. And a lot of those workouts were on the gentle side, which at first gave me a little bit of anxiety because this is my job. But I had to let go of that. Now, speaking of feeling like a flaming hot pile of garbage, along with the exhaustion, usually comes nausea and morning sickness in the first trimester to varying degrees of intensity. But often the thought of eating can turn your stomach. I know it did for me. And I just want to remind you that you should be working out in a well-fed and hydrated state. So as best you can, make sure you are eating, make sure you're drinking lots of water, and so that you're not dizzy, nauseous, lightheaded when you work out. Okay, I'm gonna wrap this video up by just kind of going through a few quick final considerations for your first trimester. First up, heat. You want to avoid working out in really hot environments during your first trimester, really all of pregnancy. Increased fetal heart rate is associated with increased maternal body temperature. So it's something we want to be mindful of, especially if you're doing a prolonged workout like 45 minutes or above. So stay hydrated, work out in air conditioning if possible, and take more breaks than you normally would. Throughout pregnancy, be liberal with your break taking, okay? Next up, blood pressure. So up to 10% of pregnancies have preeclampsia. So if there is even a slight elevation in your blood pressure during pregnancy, consult with your doctor before going forward with working out and just make sure that you get their guidance and they're okay before doing so. Next up, stress management. Stress affects our overall healing and function. And guess what is tied to increased levels of stress? Shallow breathing. So if your breath is all getting caught in your shoulders and you're not getting that deep diaphragmatic breath going, that increases our sympathetic response. And remember, our sympathetic nervous system is the fight or flight. So that's increased stress hormones. So if you need another reason or more incentive to start working on diaphragmatic breathing, there you go. And things like breath work, meditation, body scans, all of those practices can be really beneficial during pregnancy in helping you keep your stress levels down. So that is pretty much it. We want to start working on diaphragmatic breathing and connecting to our pelvic floor. We want to go easy on ourselves if we feel like crap and miss a few workouts. It's bound to happen. Pregnancy is not the time to have a rigid workout schedule that gives you anxiety if you don't follow along. We got to kind of practice going with the flow a little bit. For the most part, you can continue to do what you're doing. We just might want to dial down the intensity in certain instances. And we want to start being mindful of pressure management and noticing how are we managing pressure out on our midline, down on our pelvic floor during different exercises. And if an exercise comes up where we notice we can't get that pelvic floor engagement, we can't contain that pressure out on our midline, then that would be a sign that that's an exercise we want to modify or eliminate. If you have any questions, leave them below in the comments. I'm happy to answer them. And again, I'll do another video like this for the second trimester and the third trimester. In the meantime, enjoy the prenatal classes I'm posting every Tuesday and Thursday, and I'll see you next time.